Last video we learned about knees impingement test, and today's video we are going to learn about Hawkins Kennedy test. Hawkins Kennedy test we can perform when patient is in standing position. Therapist will be standing just side by the patient. You take patient's hand, go for 90-degree flexion from the shoulder, 90-degree flexion from the elbow, and go for internal rotation. Now if the pain is present or patient's facial expression is changing, then we confirm that test is positive. This test is positive whenever the supraspinatus tendon is getting impinged between the coracoacromial ligament and coracoid process. And this happens because of secondary impingement, which is also called as peritonitis or tendinosis. Also, there is more accurate way of doing this test by bringing the shoulder 90-degree flexion along with that 10 to 20 degrees of adduction, then elbow flexion and going for internal rotation. Plus, there is also one more version which we call it as modified Hawkins Kennedy test, in which therapist is going to place a hand on the opposite shoulder, stabilizing the shoulder like this 90 degrees, go for elbow flexion and then go for internal rotation and test for this. There is one more test similar to this which we call it as Yoakum test, in which we ask patient to touch the opposite shoulder like this and then we bring the elbow downward like this. So all these tests can be performed to figure out if there is anything wrong. Impingement is present from the anterior side of the shoulder joint.